Okay, so now Pete, the fourth part, and hopefully it's gonna be the last one. Okay, so if you are a 5-year-old boy who have a palpable, non-blanching rash on the buttocks and abdominal exam show mild tenderness to palpation without rebound, pH is 7, protein is +1, blood is moderate. What is that?
Henophilin.
Yeah, excellent. It's an IgA-mediated leukocytoclastic vasculitis. Clinical manifestation, they have purpura arthralgia and abdominal pain and dissociation, and plus renal artery disease similar to IgA, the renal disease similar to IgA nephropathy. Labs, you will have normal platelet count and coagulation studies, but normal to increase creatinine, plus hematuria, RBC cast, plus minus proteinuria.
Mm-hmm.
How do you treat it? You just hydrate and non-steroidal anti-inflammatory drugs. Okay, but if the patient have severe symptoms, then you hospitalize and give them systemic steroid. Okay, so that's about it for this condition. Now, if you're a 7-year-old boy with right leg tenderness, erythema, and warmth, and temperature of 103, what bug is causing that?
Right leg tenderness, warmth, and what else?
And high-grade fever. You have
High grade fever.
malaise and pain in right leg for the last 3 days. 7 out
Mm-hmm.
of 10 intensity. So this is osteomyelitis. Okay,
Mm.
most common as Staph aureus. So it's causing. Hmm?
Yeah, go ahead.
What is that sound of music? What is that?
Sorry.
Okay,
Yeah.
if you are a 5-year-old girl
Mm-hmm.
with fever, nasal congestion, rhinorrhea that began 10 days ago, but now you have swelling of the nasal turbinate with purulent nasal drainage.
Mm-hmm.
Okay, dripping in the posterior pharynx.
Mm-hmm.
So what's the predisposing condition for that?
What's the Is bacterial sinusitis?
Yeah, good job. It's caused by viral upper respiratory tract infection and then causes bacterial sinusitis. They call it double sickening. They have a viral upper respiratory tract infection and then they have sinusitis.
Mm.
So this is interesting. Now, if you're this has been confusing topic too for me. It was a confusing one. A 3-year-old boy who presented
Mm-hmm.
with runny nose, dry cough, fever for the past week, and developed a facial rash 2 days ago. Now, when I examined him, I found tired appearing boy with watery and injected bilateral conjunctiva, and there is a tiny white round lesion present in the conjunctiva and buccal mucosa next to the first and second upper molars. Oropharynx is and tonsil erythematous, and there is a small rubbery mobile lymph node along the anterior and posterior cervical chain,
Mm-hmm.
plus a maculopapular rash all over the body. What is,
Roseola?
huh?
Roseola?
You mean robiola? Yeah, it's
Rubio.
measles. Measles, robiola.
Yeah, rubiola.
Yeah.
Yeah.
So it present with
Hola.
the initially with a prodrome of fever,
Mm-hmm.
malaise, anorexia, conjunctivitis, coryza, cough, and Koplik spot. Okay, and then after that, present with exanthem, which is a blanching, reddish brown, reticulopapular rash, cephalocaudal and centrifugal spread, and usually spares palms and soles. Diagnosis with a PCR and acute and convalescent serology for anti-measles, IgM, and IgG. Prevention by live attenuated measles vaccine, treatment, supportive care, and vitamin A for hospitalized children. And they have a complication of otitis media, pneumonia, and a neurologic complication like encephalitis within days. And they have acute disseminated encephalomyelitis within weeks, and subacute sclerosing panencephalitis within years. And they can be complicated to gastroenteritis. So that's the measles story. Yeah, now this is an important one. If you are a 10-year-old girl with bilateral eye discharge, the temperature is 36, and she had a bilateral chemosis, mild eyelid swelling, and
Okay,
mucopurulent
bilateral chemosis,
yeah, plus a mucopurulent discharge.
mucopurulent discharge.
Yeah, so
Okay,
what's your diagnosis?
so this would be, is it bacterial conjunctivitis?
Yeah, which one? It's a
I said
10-day-old girl, 10-day-old girl, but
Oh,
which?
10-day-old girl. What do you call it? Chlamydia.
Yeah, excellent. We treat that with oral erythromycin,
Mm-hmm.
okay? And but if it was 2 to 5 days, we
Gonorrhea.
treat with IV or intramuscular ceftriaxone or cefotaxime.
Mm-hmm.
If it was chemical, we treat with eye lubricant. Now, if you're a 3-year-old male with a lump on your right neck that started yesterday and it's increased in size and now erythematous and tender, and there is a 5 cm anterior cervical lymph node palpated in the right side, it is poorly mobile, warm, erythematous, and tender to palpation. So, what organism is causing that?
Is it Staph aureus?
Excellent, yeah, Staph aureus.
Adenitis?
Yeah, Staph aureus, good job. Now, if you're a 20-day-old girl with jaundice, difficulty feeding, and for the past 2 days, she has not been waking for feeds and sleepier than normal, difficult to console. Blood pressure
Okay, hold
70,
on. 20-day-old girl, difficulty feeding.
Yeah, let me give you the vitals, will tell you a lot. Temperature is 35 I mean. Blood pressure 78/52. Pulse is 150. Okay.
Okay, so
Child
maybe this
is
is
lethargic, decreased tone. What is that?
group B, sepsis.
Yeah, so this is manifest sepsis. So the first thing you do, bacterial culture and antibiotics. That's what you do. So the clinical manifestation of neonatal sepsis, including meningitis, that was present in more than 50% of the cases. They have temperature instability, like fever more than 38 or less than 36, plus poor feeding, irritability, or lethargy. And what can happen in 25 to 50% of patients with respiratory distress, vomiting, seizure, and jaundice. And other symptoms, they can have apnea, cyanosis, and bulging fontanelle. Okay? Now, good one. If you are a 5-year-old boy with runny nose, congestion, and mild cough, but the cough worsening to the level that you vomit after cough, plus bilateral subconjunctival hemorrhage and periorbital petechiae. What's your diagnosis?
And what?
Periorbital petechiae. What's your diagnosis?
Is this Bordetella?
Yeah, excellent. This is Bordetella. Now, 1-year-old girl was in exam. She's hypothermic, lethargic, and has a nuchal rigidity. So, as it transferred in the emergency room, she developed sudden hypotensive episodes. And the child died. So, what's causing that?
Oh, wow. Meningitis?
Yeah, they call it fulminant meningococcemia.
Denyxuria.
Yeah, that can damage the adrenal gland, because
Mm-hmm.
Fredrickson
Mm-hmm.
Waterhouse Fredrickson syndrome. Now, 3-year-old boy with cystic fibrosis and infiltrate on the right and lower lobe. How do you treat that?
Oh, cystic fibrosis. So I guess this is tough. How do you treat that?
Yeah, you give
Oh, okay, you're
vancomycin.
yeah, okay, vancomycin and also mucolytics or something like that.
Yeah, yeah, IV vancomycin. But if the once the child pass age 20,
Then Pseudomonas,
yeah,
yeah.
then
So
Pseudomonas.
anti-Pseudomonas, yeah.
Then Pseudomonas, you gotta give them Mecassin, ceftazidime, Cipro. Okay, so those are the things. Now, if you are a 7-year-old girl, on physical exam show a deep puncture wound on the anterolateral aspect of the right forearm. Your wound is copiously irrigated with saline and cleaned with providone iodine. So it's like a wound, cat bite. So how do you treat that? How do you give for that?
Cat bite.
Yeah.
Oh, you give them augmentin.
So
Amoxicillin clavinolate.
yeah. So cat bite most commonly like organism is Pasteurella multicida or
Mm-hmm.
anaerobic bacteria. The
Mm-hmm.
management first you do copious irrigation and cleaning,
Mm-hmm.
and then you give the amoxiclav, and then you give tetanus booster. Plus the for last thing, avoid closure of the wound. Now, if you're a 17-year-old girl with decreased appetite, okay, and multiple tender mobile posterior cervical lymph node, plus erythematous tonsil, what's the diagnosis?
Um, I am infectious mono.
Yeah, so we diagnose it with positive heterophil antibody monospot test,
Mm-hmm.
plus atypical lymphocyte and transient hepatitis. You manage it by just avoiding sport for 3 weeks, more than 3 weeks. Okay, they can have hepatosplenomegaly too. Okay, now if you're a 4-year-old boy who have widened paravertebral space without other abnormalities, with
Widened paravertebral space.
yeah, and you have fever, neck pain, and nasal congestion, what is diagnosed?
Widened paravertebral space.
So this
With
is
what?
typical for retropharyngeal abscess.
Okay.
Now we discussed that erythromycin for chlamydia conjunctivitis. Now, 7-year-old boy with perianal erythema, microscopy shows several eggs. How do you treat that?
Give them albendazole.
Yeah, or parental pamoate
Enterobus
for the
famicularis.
for the patient and all household contact.
Mm.
You give
You give them
yeah
what?
hmm? You give them albendazole or parental pamoate for the patient and all
Okay.
household contact. Diagnosis: you will find eggs on tape test, and symptom they have perianal pruritus, especially at night. Okay, enterobius vermicularis. Now, if you're a 7-year-old boy with red bump remained at the site where the tick attached, one
Red thumb
red bump
or bump. Okay, where?
like on the site where the tick attached,
Or tick. Okay. Mm-hmm.
okay, and the exam shows rash of erythema chronicum migrans. How do you treat
Mm-hmm.
that in a
For
7?
how long has that been going on? But anyway, you're gonna remove it. Yeah, with
Yeah, it's
you
been
remove
going on
it
for
with
the past 2 weeks.
okay, so you're gonna remove it with what do you call it? what is it that you use to remove
Yeah,
hair?
you use
And then you're gonna give them also prophylaxis. If it's going on, if it's been going on for 2 weeks, you have to give what amoxicillin. But if it's less than 48 hours, you don't have to treat them. That's
yeah,
what yeah, yeah. 48. They said it takes 48 to 72 hours for the back what do you call it? The fly to get under the skin and get into the bloodstream. But if it's less than 48 hours, you just remove it and you don't treat. But if it's more than that, you have to remove it and then you have to treat. And since he's 7 years old, you give amoxicillin, not doxycycline.
yeah. Good job, good job. Now, if you are a 7-year-old boy
Mm-hmm.
brought to the physician by the mother because of bleeding gums for the past 3 months. So that was confusing one for me too. So bleeding gums, and the boy regularly brushes his teeth,
Mm-hmm.
visit dentist twice per year.
Mm-hmm.
Okay, but not just that, the story has more to it. There is easy fatigability.
Mm-hmm.
Height is a 25th percentile for weight, and so the height and weight, they are they're below the 25th percentile.
Mm.
Thumb slightly bent, and several areas of hypopigmentation.
Okay. Okay.
Hem-
Fanconi's anemia.
yeah, good job. So it can cause, yeah, this is chromosomal breaks, Fanconi anemia. So
Mm-hmm.
it can cause bone marrow issue, aplastic anemia, progressive bone marrow failure. That's why the hemoglobin was low, RBC low, everything was low here. And appearance, short stature, microcephaly, abnormal thumbs, hypogonadism. Skin causes hypopigmented or hyperpigmented areas, cafe au lait spot, large freckles. Eyes and ears cause there's strabismus, low set ears, middle ear abnormality, hemorrhage, incomplete development, chronic infection, deafness, and so on. So, what are the other causes of aplastic anemia?
Other causes of plastic anemia. Okay, so Fanconi can cause it. Radiation can cause it. Toxins. Um, things that can affect the bone marrow. So toxins, radiation, Fanconi. What is this one again? Um, yeah, all these
Yeah,
other hematological
yeah,
issues.
yeah. Benzene, glue, those chemicals could be idiopathic. Could be
Mm-hmm.
non-steroidal sulfonamide can cause that. So, 11-year-old boy with sickle cell anemia, present with shortness of breath, fatigue. Hemoglobin is 4.5, reticulocyte zero point 0.1. What's your diagnosis?
So this will be, what do you call it? Aplastic crisis.
Yeah, if the reticulocyte was high, then that would
Then
be
it will be
hemolytic,
yeah.
hyperhemolytics. Okay. Now there's 3-year-old boy who had a firm non-tender mass palpated in the
How
left
old?
abdomen.
Three
3-year-old,
year old. Mm-hmm.
yeah, firm non-tender mass palpated at the left abdomen.
Okay. Does it cross the line? If it doesn't cross the line, Wilms tumor.
Yeah, it is Wilms tumor. So
Mm-hmm.
its most common malignancy in childhood. Fourth common cause childhood cancer. Peak in 2 to 5 years, and usually sporadic. Associated symptoms, they have Wager, which is Wilms tumor, and Redia genitourinary, intellectual disability, mental retard, and they have Pick with Wedmian syndrome, Denise Trash syndrome. Clinical presentation asymptomatic, firm, smooth abdominal mass that does not cross the midline. Treatment with tumor excision or nephrectomy chemotherapy or radiation. Prognosis 5 years survival with the treatment 90%. Okay. Now, if you are a 3-year-old African American boy who have a sudden difficulty walking and the right hand seems clumsy, blood pressure 90/60, temperature is 120, respiratory rate is 22. So what is helpful in diagnosis?
Maybe hemoglobin electrophoresis.
Peripheral smear and reticulocyte count. This is sickle cell anemia.
Mhm.
Electrophoresis, yeah, helpful too.
Depending on what is given.
Yeah, you're right. Yeah, they didn't mention it. Phoresis. Yeah. So 7-week-old boy who was
Mhm.
born 32-week gestation. His hemoglobin is 7.8. Hematocrit 24%. So what is causing this normocytic normochromic anemia?
What do you call it? Hemo Anemia of a prematurity or whatever.
Wow, smart. Yeah, so it's impaired erythropoietin production.
Mhm.
That's the cause. It could be short red blood cells lifespan, could be iatrogenic blood sampling. Okay, manifestation usually asymptomatic, but they can have tachypnea, anemia, weight gain. Okay, labs, they have low hemoglobin, hematocrit, low reticulocyte count, and normocytic normochromic red blood cell. So this is
Mhm.
important. How do you treat it? You minimize the blood draw. You don't draw blood from them too much. You give them iron and transfuse if they need it. Okay? Sounds good.
Sure.
Now, if you're a 1-year-old boy who says, Mama, Dada, go balls. His hematocrit 31% and the MCV is 64%. RDW is 13% normal. What's diagnosis here?
So if the RDW is normal, so it's not iron deficiency anemia. Likely is going to be thalassemia.
Yeah, iron deficient.
MCV is
Yeah,
64%.
yeah,
It's not iron deficiency anemia.
yeah,
So likely either sickle cell or thalassemia. Yeah.
yeah. Excellent. Thalassemia, they have low MCV, but normal hemoglobin electrophoresis, normal iron, TIBC, RBC. Okay, or sometimes they have increased iron actually. Same thing with alpha thalassemia.
Mhm.
Alpha thalassemia and beta thalassemia, the only thing is hemoglobin electrophoresis, there's increased hemoglobin A2. But alpha thalassemia, they have normal electrophoresis. Iron deficiency anemia, you know the labs, decreased iron and ferritin and increased TIBC. In response to iron, it responds well to iron, but the alpha thalassemia and beta thalassemia doesn't respond. So the trick, sometimes they trick you, they don't give you RDW and stuff. They just tell you, we gave him iron, didn't work, so what do you do? Okay, so that's the thing. Now, how do you manage sickle cell anemia?
How do you manage it? IV hydration, oxygen, PEM meds.
Yeah, there are maintenance, which is vaccination, penicillin till age 5, folic acid supplementation, and hydroxyurea. And there are acute pain crisis, acute pain hydration, hydration, analgesic transfusion. And that is the management of sickle cell. Okay, now this is interesting thing. You have a 3-year-old boy who brought to the physician due to right knee swelling. There is multiple ecchymosis on the anterior shin bilaterally. So what do you do next? What do you order?
Arthrosynthesis.
So this guy, let's order CBC and coagulation studies first.
Okay.
Yeah, because could
Oh,
be
is it maybe leukemia?
yeah, it could be hematolosis. So there are 3 types of clotting disorder, bleeding disorder. What are they?
So you have the hemophilia A, you have the B, you have the von Willebrand disease.
Yeah, those hemophilia, it's all clotting defect. So there are clotting defect, and there is a platelet aggregation defect, and there is a thrombocytopenia. The clotting defect cause hemarthrosis, deep tissue hematoma, example hemophilia A and 2. Okay, lab you have increased PTT, partial thromboplastin, while platelet aggregation defect and thrombocytopenia 2, they have easy prolonged mucosal bleeding. So there is deep bleeding and there's a mucosal bleeding. They have ecchymosis and petechiae too. So platelet aggregation disorder like von Willebrand, Bernard-Soulier, thrombocytopenia could be idiopathic, could be leukemia. Okay. Both they have abnormal platelet tests. Thrombocytopenia decreases platelet for sure. Platelet aggregation, they have abnormal platelet function testing, like ristocytin and these types of testing. Okay, now, if you're a 5-year-old boy, okay, with the conjunctiva and skin pale and
Conjunctiva?
yeah,
Conjunctiva,
and
okay.
skin pale, petechiae present on the extremities, plus hepatosplenomegaly. So you did check the leukocytes is 24,000. Temperature is 103. You did chest x-ray, you found widened mediastinum. What is that? What's going on here?
Widened mediastinum. 5-year-old. Oh, it might be what do you call it? ALL. Acute lympho whatever leukemia. Lymphoblastic leukemia.
Wow, amazing. I admire your knowledge. That's amazing. Yeah. Yeah, so this is ALL actually. Most common childhood cancer. Peak in 2 to 5 years. More common in males than females. Clinical presentation is non-specific symptoms. They can have bone pain, hepatosplenomegaly, lymphadenopathy, pallor from anemia, and petechiae from thrombocytopenia. Diagnosis, you do bone marrow biopsy. You find more than 25% lymphocyte, boom, that's confirmed. How do you treat it? It's complicated. You give multi-drug chemotherapy. What decreases risk of sudden infant death?
Okay, so you put them on a prone while sleeping, decrease what do you call it, secondhand smoke, and also put them on a hard mattress, not soft, and no blanket or things like that around the baby while sleeping.
You said put them on a prone?
Prone position, back
No,
to sleep.
supine, they call it
Supine, back to sleep. Yeah, put them on their back.
Be careful.
Prone is face down.
Yeah, be careful. Supine position.
Supine position, yep.
Okay, 3-year-old girl. All her veins are collapsed. So what do you do? How do you do IV access?
Oh my goodness. There is this thing you do on the leg.
Interosseous, yeah.
Yes.
This is a funny question. I've never seen it being asked.
Uh-oh.
Newborn with moon-like faces, hypertelorism, bilateral epicanthal fold, high arched palate, and wide, flat nasal bridge. So, what chromosome abnormality consistent with the finding?
Moon face, hypertelorism.
Yeah, this is called the Cri-du-Chat syndrome, 5p deletion.
The one that is like a cut.
Huh?
Okay, chromosome 5 something.
Yeah, deletion of 5p chromosome. So how do you manage mild dehydration?
Mild
Yeah,
dehydration.
in kids.
You can do oral rehydration.
Yeah, so there is mild dehydration, which is present with history of decreased intake and increased fluid loss with minimal or no clinical symptoms, just oral. And there is moderate dehydration. So these symptoms are important to compare. Mild dehydration, only 5% volume loss, while moderate dehydration is 9% volume loss, or 10, let's call it. Decreased skin turgor, dry mucous membrane, tachycardia, irritability, delayed capillary refill 2 to 3 seconds, and decreased urine output. While severe dehydration, which is 10 to 15 way volume loss, present with cool, clammy skin, delayed capillary refill more than 3 seconds, they have cracked lips, dry mucous membrane, sunken eye, sunken fontanelle, tachycardia, lethargy. Okay, patient can present with hypertension and signs of shock when severely dehydrated. That's how you present. Now, if you're a
Okay.
5-year-old girl with lethargy and altered mental status, PTT and PT are high. AST, ALT around 500 each. So what's your diagnosis?
5-year-old.
Yeah, you
Girl.
used over-the-counter medication.
Oh, rice syndrome.
Good job. Yeah. So it's due to microvesicular fatty infiltration, hepatic mitochondrial dysfunction. Etiology is pediatric aspirin use in setting of influenza or varicella. Feature, they present with acute liver failure, encephalopathy. Lab, they have increased transaminase, increased PT, increased INR, and PTT, and increased ammonia. So how do you treat condition when you find ultrasound thickened intestinal loops are floating free in the amniotic sac? What is that?
The gastrokisses, is that what you're asking me?
Smart, good job. Now what
So
is
you're gonna, is it when the baby is born? How do you treat it?
yeah, surgical.
So it's the one that you use like a saline gauze or whatever, to kind of like cover it to prevent, loss of fluid, and also to prevent infection, and then or correct if there's any electrolyte abnormalities, and then take the baby to surgery.
Yeah, exactly. Nice, yeah. How do you differentiate Hirschsprung from Meconium, Elias?
So Hirschsprung is associated with Down syndrome. Meconium ileus is associated with cystic fibrosis. On Hirschsprung is due to problem with the what do you call that thing? Something plexus. What is that? Okay, let me keep going. So for the Hirschsprung, you are going to see absence of what do you call it? There will be like a point where you will not see anything, absence of a dilation, something
So
proximal dilation and whatever.
there
Yeah.
are two
Airbag,
there are
absence of airbag. Yeah.
there are two things. There is level of obstruction and meconium consistency. So
Mm-hmm.
Hirschsprung disease, level of obstruction in the rectosigmoid, while
Mm-hmm.
meconium ileus in the ileum. And the consistency in Hirschsprung is normal, while in meconium ileus
Mm-hmm.
inspissated. Okay, so that's the main difference between these.